I'm a cannabis specialist. I spend my time taking care of patients using cannabis.
What advice would you give to someone who doesn't really know anything about cannabis? You know, they're coming to you as a patient for the first time because maybe someone recommended it, but wasn't a doctor.
Sure. Well, I mean, that's exactly who tends to come to see me, is the people who somebody has said to them, you know, you have this illness or condition that might be something that we could treat with cannabis. Why don't you go find out about it? And then they Google and they find me, or better yet, they've asked their own doctor, and their own doctor says, well, look, this isn't my area of expertise, but you go see Jordan. I know him, and I think he's a reasonably intelligent guy, and he can help you out with that sort of thing. I spend an hour with each of my patients to begin, and spend a lot of that time talking about the questions that you're asking. What can cannabis do? How does it work? What forms does it come in, and how do you take it? What are the pitfalls, things to avoid, what side effects, that sort of stuff, all of which leads to a very specific plan for that patient that is tailored to their illness and needs.
So, you know, through that, what would you say are the biggest sort of problems that patients, you know, bring to you in the whole experience of, you know, trying cannabis for the first time as a, you know, medicinal?
Well, I mean, there's
preparation?
some amount of unnecessary concern due to the stigma that we've all grown up with. So a fair amount of my time is in trying to help them understand that a lot of what they have been led to believe is not really accurate and founded in science. But then there's the flip side, which is that a lot of them have read a lot on the internet that is equally bunk. And so we spend a fair amount of time talking about, you know, just because you read about CBD on some website does not necessarily mean it's the drug for you.
And to that, you know, what advice would you give to lawmakers to help you do your job better?
Well, I think that the biggest thing is for lawmakers to understand that patients and recreational users are very different groups of people with different needs. And it's my belief that both groups are absolutely legitimate, but that the approach to taking care of those groups' needs to be different. And that right now we are sort of barreling forward as a group of states, and possibly even as a nation, towards legalizing this stuff for recreational use, and I think that's a great thing. But I would be very upset if in that process we don't take a little time out to remember that every one of us is at some point going to be or become a patient, and we need a system in place so that we physicians can take proper care of our patients.
And to that, one of the issues I know that many businesses and business owners have, you know, in the cannabis industry is this issue of marketing. And as a doctor, how do you market your business?
Oh, that was not the question I thought you were going to ask. I market my business through the usual, you know, internet, word of mouth, that sort of thing. That's tended not to be a big deal for me.
So what question did you think I was going to ask?
Well, because I thought you were going to ask me about marketing of products, which is something where I find that we have a big problem in this industry. That is to say that there are organizations like dispensaries and product manufacturers out there that are making unsubstantiated claims about cannabis. And ultimately, that may very well help their marketing in the moment or their sales in the moment, but it ultimately harms patients, and ultimately that goes on to put a black mark on our industry.
Right, and doesn't that put you in a tricky position? Because like you said, you can market yourself as a doctor, but if you are then, you know, receiving product, or, you know, I would assume it's somewhat similar to, you know, the way pharmaceutical companies, you know, somewhat similar, I know it's not the same at all, how they market drugs, right? Cannabis, obviously, you know, it's not a prescription, it's a recommendation, so it's a different process.
It needs to be a prescription.
Right.
Is what it needs to be. Because what prescriptions do for us is it takes the arm twisting and salesmanship out of the purchasing of the medicine. So when you go in to the CVS with a prescription for whatever, blood pressure medication, the pharmacy isn't twisting your arm and saying, wink, wink, would you like a side of Percocet with that, right? They're constrained to what was written by the clinician. We need that sort of thing in the cannabis world so that patients get what I need them to get so that we get the results that we expect, as opposed to what we see now is that I write out all of those things, but it doesn't have any force of law, so when they get to the dispensary, they're often said things like, oh, I don't know what Dr. Tishler's talking about, don't listen to him, I'll tell you what you need. And then they get whatever, and then they call me up 3 days later and say, Doc, it isn't working. Or worse yet, Doc, I feel sick. Why? Well, what are you doing? Oh, well, you're not doing what I told you you ought to do. You're doing what, the 20-year-old at the store said, and clearly that doesn't apply to you because now you're not feeling well.
There is such a disconnect in cannabis and medicine, and I know you spoke on a panel earlier today about cannabis as a bridge from medicine as in big pharma to health and wellness, or using it for nutritional value, that sort of thing. If you're talking about CBD or hemp seeds, or for protein, that sort of thing. So, what do you think are the sort of the top, if you had like either top 3 or top 5, ideal, like that would really help your business and help patients? Like, what are those things that you would suggest that need to happen? Sorry, I didn't really finish my
Yeah,
sentence.
so I think we need to educate my clinician peers, and you can kind of separate the doctor group into 2 groups. There's the folks who are going to do what I do, which I call cannabis specialists, right? And then there's this other group that are the doctors who are not going to do this, but they need to know enough to refer to the specialist, and they need to understand the legitimacy of this as medicine so that they feel comfortable making that referral. So that's one thing that we need to accomplish. We obviously need to work on the federal government to get them to acknowledge both the value of this as medicine, but then also to place a national policy, a prescribing policy that allows me to write something very specific for my patients. And it works nationally so that when my snowbirds patients want to go to Florida, they're not stuck. Because that's what's happening now, is I can get people taken care of in Massachusetts, but if they go to Florida, then, they're either breaking the law by taking it with them, or they can't get it there, or that sort of thing, which obviously is not the case with regular pharmaceuticals. And then the other thing we really need to do is to work with product manufacturers and dispensaries to elevate the products that they're making. Everybody talks a lot about edibles, for example. Well, in the medical world, we don't want to be prescribing take 2 brownies and call me in the morning, because that's not good for people. People might be overweight or diabetic or whatnot. So we need products that more appropriately fit the therapeutic goals. And to this end, actually, I started a now international group called the Association of Cannabis Specialists. And we are a group of doctors who are concerned and have banded together to help patients, to raise the standard of care, to work on the federal government, and to work with the manufacturers, as I mentioned.
Oh, that's great. So, to change tracks a little bit, I mean, this is your first, was your first CWCBE
Yes.
conference. Some general impressions?
It was wonderful to be here. I'm very grateful to have been included. I think it's a fantastic conference. I do a lot of conferences, so I have a pretty broad basis for comparison, and I have to say that this is definitely among the top. A great group of smart minds, businesses that are trying to take this whole field in the right direction, and some very good topics as well.
That's great. Thank you so much.
Thank you.